Hi folks, and welcome back to another video of Boondock Medicine. Today we're going to talk about irritable bowel syndrome. A lot of people have it. It's not a good thing to have. Everybody calls it IBS. Irritable bowel syndrome is one of the primary reasons, believe it or not, people visit a doctor. Its usual symptoms of constipation and or diarrhea, along with severe bloating and gas, can be caused by a variety of ailments or conditions. Be sure of your diagnosis before exploring your treatment options. As with everything, today when you see a practitioner, you will want him or her to look for abnormalities such as food allergies or intolerances, and for digestive problems caused by insufficient pancreatic enzyme or stomach acid production. Parasites from tainted water and food can cause the same symptoms as IBS. The overuse of antibiotics can lead to the overgrowth of yeasts and other unhealthy bacteria. A healthy bowel needs maintenance that involves good eating habits, including the following. Get some fiber. Get enough of this key component from fruits, vegetables, and from some grains. Fiber can help both constipation and diarrhea by regulating peristalsis. Peristalsis is the involuntary muscle contractions of the intestines. Avoid gas-producing foods such as beans, cabbage, carbonated beverages, or consume them in small quantities. Sugar, because carbohydrates can ferment in the intestines, can produce gas. Many people find that cutting out refined sugars can reduce or even eliminate symptoms. Avoid irritants like fatty foods and coffee and that can produce intestinal spasms resulting in cramps or diarrhea. Try alternatives to coffee and drive past the burger joints. You don't need that fat anyway. Let's talk about supplements. One of the most helpful supplements for IBS is Lactobacillus acidophilus. This bacterium has been known to suppress an overgrowth of unhealthy bacteria, yeasts, and parasites. Lactobacillus acidophilus can be obtained in powder or capsule form. And find a product that has at least 2.5 billion live organisms per gram and take 1,000 to 4,000 milligrams per day. Other useful supplements are digestive enzymes like papain from papaya, bromelain from pineapple, and culture molds such as the Aspergillus species. The dosage is 1 to 4 capsules taken with meals following the manufacturer's directions. All of these enzymes are safe to use for extended periods. Okay, let's talk about herbal remedies. Peppermint. Peppermint's great. Pain-relieving, anti-inflammatory, and antimicrobial. Peppermint has a long history of use for the intestinal problems, including indigestion, cramping, and bloating. It also fights yeast organisms. Mints are members of the group of herbs called carminatives, and I think I'm pronouncing that right, which relax the muscles of the lower esophagus and allow release of gas trapped in the stomach. 1 to 2 capsules or 1 to 2 or 3 times a day. Caution, don't take internally if you have heartburn or esophageal reflux. Psyllium. Psyllium is rich in fiber similar to those found in oat bran, flaxseed meal, and gar gum. These fibers from a soft, bulky material that gently regulates peristalsis. The typical doses is 2 teaspoons of powdered seed in 8 ounces of water once a day. And our friend chamomile. This herb acts as a sedative, relieves gas, calms intestinal spasms, and fights inflammation. It does all that. It soothes the gastrointestinal tract and helps fight constipation and diarrhea. So you thought that chamomile tea was just sitting on your shelf just so that you could look at it, but it is a lot more than that. Typical doses is 3 to 4 cups of tea per day, or 300 to 400 milligram capsules per day taken with meals. It does come in capsule form also. All right, ladies and gentlemen, that's it for IBS. This is Doc signing off. If you like what we're doing, we're going to do a lot more stuff than actually the medical stuff. We're going to go on the special ops side of the house pretty soon and talk about desert survival and winter survival and a couple other survival things. So if you like what we're doing, subscribe. Be well. This is Doc signing out. AMF.